We're going to be using an ultrasound scanner today, and this is going to allow us to scan all the vasculature from the jawline, facial artery, inferior superior labials, angular artery up to the lateral nasal artery. This will allow us to understand the anatomy in depth using Doppler mode of vasculature, particularly the arterial tree, and also understanding the plane so we can better understand why we place product in a certain plane for a certain area. I'll be discussing various techniques to treat the nasolabial fold as well as the anterior cheek, showing you safe landmarks to deliver the treatment, as well as discussing options for various instruments. Right, perfect. Okay, so Beatrice, we're just going to come into the scanner. So I've just got some jelly. If I just get your chin up a little bit. Perfect. So we're just going to be scanning. We'll scan along from the jawline, finding the facial artery, and I'm just going to discuss the planes. So we're using the Clarius probe here. And looking at the scanner, you can kind of see at the top of the screen is the superficial aspect, and as we go further down the screen, it becomes deeper. So you can quite clearly see a very deep or well demarcated white line that runs across the screen there. And that's highlighting the mandible, and we can kind of see the bony appearance of the mandible as well as then the bone underneath. If we just zoom in a little bit here, Chris, so we can kind of see a little bit further up, and we slide up a little bit. There we go, and just slightly zoom out here. Perfect. Good. So here we can quite well see from the superficial aspect, the skin, the subcutaneous fat, then the firm hyperechoic structure, which is the mandible. If we glide along here, we'll be able to find the Manson's point or the mandibular notch, and along that point we'll be able to see the arterial tree. So at this point you can kind of see the pulsating facial artery. We'll swap over to Doppler mode here then as well, and we can then make it easier to follow this as we glance along this plane here. So bringing that back into the center of the screen, you can see that arterial pulsating structure. So this is the facial artery. I'm going to scan up further here, but from this origin you can see it's quite deep. It's located very much at the bony layer, the periosteum, which is why when we treat jawlines we try to treat superficially.